Hi, I'm Dr. Kerry D'Ambrogio, and welcome to our new website. We've created this place to be a resource for you, not just to find out about my work, but to learn new tools that you can apply immediately to make a difference in your professional practice. As a practitioner, ask yourself a few questions. Can you evaluate every muscle in the body, every joint in the body? Can you evaluate the fascia around the muscles, the joints, and the organs? And also the fascia around nerves, arteries, veins, and lymphatics, and the meninges. How do you know where to begin a treatment? Are you going to go after the symptoms, or are you going to go after the cause? How do you know which technique to use? Are you going to use muscle techniques, joint techniques, fascial techniques, fluid techniques? How are you going to integrate these different techniques? How do you know when you're finished treating? And how do you know when to refer out? These questions and more are going to be addressed in our seminar series. It all starts with evaluation. Our focus is to teach you an integrated full body evaluation and the tools necessary to correct whatever comes up. My background is I started as an athletic trainer, and then I went on to become a physical therapist at the University of Toronto in Canada. Later I moved here to Sarasota, Florida, and became a doctor of Oriental medicine. I then went on to study osteopathy, not just in one school. I went to two schools. One was in Hamilton, Ontario, Canada, and the other one was in Maidstone, England. And I've been lecturing since 1988 in over 20 different countries. You might already be familiar with the Upledger Institute. John Upledger set it up, and his focus was to teach craniosacral therapy and somatoemotional release. Jean-Pierre Burrell set up the Burrell Institute, and his focus was visceral manipulation as well as neuromanipulation. And also Chickley, the Chickley Institute. Their focus was teaching you lymphatic drainage. I was a student of each of those practitioners. The DAmbrogio Institute was designed to complement and integrate those modalities, as well as add additional courses to create a comprehensive system to meet the needs of our students. Together, we're all part of the International Alliance of Healthcare Educators. So, at the DAmbrogio Institute, we're going to focus on critical thinking and case study format, along with the understanding of anatomy, biomechanics, and physiology. We're going to use both Eastern and Western physiology. We want to teach you effective ways of evaluating and treating your clients. We're not just going to show you protocols. We're actually going to have you use your head a little bit. We're going to show you different ways to evaluate the tissues to decide what you need to work on. We're going to show you how to evaluate the fascial system in our myofascial classes. We're going to teach you how to look at muscle spasm or guarding in our positional release therapy classes. And joint stiffness, how to evaluate the biomechanics and treat joint hypomobility in our muscle energy class. You're also going to learn a full body evaluation and treatment template. This is called the total body balancing, where we're going to teach you how to integrate the muscles, the fascia, and the joint, as well as the fluid in a seamless treatment session. This is what the classical osteopaths used to do. When it comes to evaluation, you have to use all your senses. You have to use your ears, obviously, to listen to what the client has to say to you. Also your mind. We're going to teach you to use your intuition, follow your instincts. What about your eyes? What do you observe? Do you observe changes in their posture or when we evaluate different landmarks? And finally, our hands. We want to increase your sense of touch, feeling these different tensions in the fascial system, the muscle system, the joint system. When it comes down to evaluation, we want to look at both subjective and objective evaluation. Subjectively, we want you to be aware of when patients come to you, there's usually about 2 or 3 different reasons why they're coming, or what the cause is for their somatic dysfunction. The first one is mechanical. You know, if they came to you for a mechanical problem, is the problem congenital? Were they born with it? Or was it acquired? If it was acquired, what happened to their life? Did they get into a car accident? Did they have a fall, a sports injury? Maybe they had surgery. So these things can create dysfunction in the body. But interesting enough, we can also have non-mechanical. Non-mechanical could be the weather, could be the climate, could be emotions or mental stress, could be a virus, a parasite, bacteria, could be an autoimmune dysfunction, could be your diet, could be toxicity, could be anything, something you're allergic to. And what's interesting is this can create headaches, it can create knee pain, back pain, shoulder pain, and it's frustrating. Typically what we'll find is that we're going to have a combination of the two, is that we can have both mechanical and non-mechanical in that situation. You also have to be aware of, are you going to treat a patient with acute symptoms or chronic? And what stage of healing are they into? We take all this into consideration. Objectively, we're going to teach you a system where we use 4 letters, ARTS, to help you out. The A stands for asymmetry. we are going to teach you how to evaluate posture in 3 planes. Asymmetry is very important because the more asymmetrical you are, the more it affects your functional range of motion. But when we look at asymmetry, we can look at the face, we can look at the shoulders, the rib cage, the spine, the lower extremities, the pelvis. When we look at all these asymmetries, we want to find where are the areas of greatest asymmetry, but it doesn't really tell us what's wrong. Because you could be asymmetrical because of muscle spasm, joint restrictions, fascial restrictions, or swelling. That's why we have to continue with our evaluation. We have to move on into the R, which is restriction in motion. So we will evaluate the range of motion, maybe of their spine, their neck, thoracic, lumbar, their rib cage, upper and lower extremities. And when we evaluate, both actively and passively, we want to find out what's the nature of the barrier. So for example, if I was lifting someone's arm up and they had, let's say I only could get my arm up to about 90 degrees, what does the end feel like? If it feels like a hard, solid end feel, that could indicate more joint dysfunction. And if there is joint dysfunction, the techniques we're going to teach you in total body balancing and muscle energy are going to help to resolve that. If we lift the arm up and it's more of a soft end feel and it's heavy, this is going to indicate more swelling. And therefore we can use the Chickley information, the lymphatic drainage techniques. What if I were to lift the arm up and that's as far as I could get it, and it's more of a firm end feel, sort of an elastic end feel? 2 things could be. It could be fascial, or it could be protective muscle spasm. If it's fascial, we need to determine, is it fascia around the muscles, the bones, the joints? Is it around the organs, around the nerves, arteries, veins, or lymphatics? If it's muscle guarding, we need to determine which muscle it is, and we can use positional release therapy techniques. The other thing we have to keep in the back of our mind is that emotions, consciousness, belief systems, mental stress, these can all create tension in the muscles and the fascia. This is going to be addressed in Upledger's somatoemotional release classes. So we've talked about A and we've talked about R. T stands for 3 things. Tension tests. We are going to teach you in these courses how to evaluate the tension of bones. Bones are hollow, they're only solid on the outside. We're going to test joints, bones, organ systems, the cranial system. We're going to teach you a full body evaluation. Normally when you do a tension test, the body should be soft and supple. If there's areas of hardness, that's telling us there's a somatic dysfunction. We can also feel texture changes. So when we put our hands on the muscles, normally muscles should be soft and supple. If they're really thick, if there's like little BBs in it, that tells us there's dysfunction. The third T is tenderness. If we find tenderness on someone's body, that's indicating a somatic dysfunction. And finally, the S. The S stands for special tests. Could be a fascial glide, maybe a standing forward bending test, a kinetic test. We're going to show you lots of different special tests. So when it comes to evaluation, objectively, ARTS, asymmetry, restriction in range, the T for tension test, texture changes and tenderness, and the S for special tests. So finally, the classes that we're going to teach you at the DAmbrogio Institute, each of them kind of run a 3-day format. We do lots of hands-on. We lecture, but we do lots of hands-on. You're going to be provided with a detailed manual with lots of illustrations to help you learn. We're going to also be putting together review videos for you that you can view after class to supplement your learning. My tendency is I tend to repeat each day. I'm going to review the information from the day before, and on the last day we're going to go through all the information again. I want to make sure that after these 3 days you've got something that you can use when you go home back to your clinic. We're also going to offer CEUs for these classes, and also if you take a look at the website, you can get more information from each of these courses. We're going to have videos and information on the myofascial release, the position release therapy, the muscle energy, the total body balancing. And also if you're interested in hosting one of our seminars, please let us know. So I hope to see you at one of our seminars. Thank you for listening.